Hi, thank you so much for joining us and welcome back if this is your second webinar. Today we are going to be doing things a little bit differently than last time. You'll first hear from Susan. She is our representative from Allergan, the company that creates Botox and Juvederm family of fillers. You'll then get to see live injection demonstrations from nurse injector Jamie and from myself, Kendra. We'll be doing Botox and I will be injecting cheeks. So I will now turn it over to Miss Susan Lewis, who will talk to you a little bit about Botox Cosmetic and the Juvederm family of fillers.
Hi, and welcome to Dr. Beals' virtual event. I wanted to introduce myself, Susan Lewis. I am with Allergan Facial Aesthetics, the makers of Botox and the Juvederm family of fillers. First and foremost, I just wanted to tell everyone, happy National Botox Day. Thank you for celebrating the heritage of Botox Cosmetic with us over the past 18 years, growing into an iconic brand. One brand that patients ask for by name with near universal awareness. And over 100 million vials shipped worldwide, treating millions of patients. Botox Cosmetic is the most studied neuromodulator with over 4,300 clinical publications and more FDA indications than any other neuromodulator approved to treat glabella lines, crow's feet, and forehead lines. When administered properly, you should look just like yourself, only with less noticeable lines. We are very fortunate to be injecting Botox demonstration for us today. I want to touch a little bit on the Juvederm family of fillers also. We have 5 distinct formulations with 2 innovative technologies making Juvederm the #1 demanded filler nationwide. Juvederm fillers are made from a naturally occurring sugar found in your body, hyaluronic acid, specifically engineered for lifting the cheeks, smoothing the lines on the lower face, and plumping or adding subtle volume to the lips. The Juvederm family is recognized for being smooth, natural looking, and long lasting with indications between 1 and 2 years. And we are grateful to have Kendra here doing a filler demonstration for us. I'm going to bring Kendra back so that she can get started.
Hi, me again. So we're going to talk a little bit before we jump into the live demos. We're going to show a couple slides of lip fillers. A lot of times when we think lip filler, we think big, overfilled fake lips. We've all seen them. The majority of us don't want them. I don't want you to have them. A lot of times, sometimes people do come in and they do want that big, full, sexy lips. That is possible. Sometimes people come in and they just don't want their lipstick to bleed, or they have the little lines, or they just want a little bit more structure to the lips. So I'm going to show a couple different pictures that kind of just give a nice example of what we can do with lip filler. So this first one, you can see she came in, she has pretty full lips to begin with. What we did mostly is we added height. So you got that vertical height to her top lip. She has a pretty full face, super pretty girl, and she can pull off a really full lip like this. So even though they look larger, they're full, they're sexy, they don't look fake, no duckiness. Next slide, you can see basically I didn't even put any filler in her top lip. Her top lip is stunning. It's full, it's got that really defined Cupid's bow, perfect little border. What we really needed to do was we just needed to balance the top and the bottom. So the filler went into her bottom lip so that it matched the top lip better. And it also went in a little bit to the corners to help so that they weren't so downturned. Next slide, you'll see a patient that has a little bit more mature lips. And in this case, going really big would look so artificial and so out of place on her face, but she wanted a little bit more show, and we needed to add a little bit of definition. If you see in that top picture, there's not a huge amount of definition. What you see is mostly just a color change. And there's also some vertical lines, formerly called smoker's lines. I don't want to make any accusations, so I refer to them as lipstick lines or barcode lines. We added Juvederm to those lips, and that just created more of a youthful structure and really helped to smooth out any of the lines. Next slide is a really pretty one, just really subtle. The lips look more hydrated, more youthful, and more structured. There's barely any change to the size. It's mostly just creating a youthful, firm structure without kind of that lined look. Lastly, we have really one of the most difficult lip shapes to inject is kind of the M-shaped lip. So using kind of a specific technique, what we can do is we can fill in the little gaps that are just to the sides of the center and flip the lip out. This shaped lip does have a tendency that it can look ducky if it's done incorrectly. So this is another one of the situations where you really want to make sure you're choosing your injector and choosing your product wisely. Well, your injector will choose your product. You never have to know what to ask for. But using a very targeted technique, we're able to kind of create not only that straighter line across the top lip, which is more aesthetically pleasing, but also get more height. It was kind of inverted. We want to evert it to flip it out a little bit more. And it should be ready. We want to bring our model on up here. I'll mask up for you. And Miss Nurse Jamie will get started with Botox injections.
One thing that's great about Botox Cosmetic is it's preventative. So some of our younger patients, if they start getting Botox here in the glabella, which is the frown, exactly, between your brows, it can actually be preventative because if those muscles don't keep pushing together or contracting, over time, those lines are not going to form as deep. So it is a good area for some of our. The 3 FDA approved are the glabella, which we just spoke of, the upper forehead for these horizontal lines, or the frontalis muscle there, and the crow's feet, or the periorbital area around your eyes. So there are many other areas we can use Botox for that are considered off-label or not necessarily FDA approved, but plenty of offices have done it for years. And one is the chin, which we're going to do on Erin today. See, when she makes that little face, this mentalis muscle kind of scrunches up. So some people kind of have a resting face where they either do that or it can help form these marionette lines. It also makes the texture look a little more bumpy or cobblestoney. So if you just put a little bit of Botox there, it helps with that. Another area is the upper lip for upper lip lines, the vertical lines there. If you put a little Botox in there, it helps with that, as well as it does a little bit of inversion of the lip without filler. It's called the lip flip, and you can do that. As well as some people grind their teeth or have TMJ or just have a real strong, these are called your masseter muscles. You can put a little in there to relax that. It can also help kind of define the jaw a little bit. So trying to think if I missed anything. So that's, so on Erin, we're just gonna do her forehead, this spot here, her eyes, and her chin today, because everything else looks fabulous. Botox, 3 to 4 months. I'm gonna have you close your eyes. Sometimes they strip. Thank you. What's nice about Botox is it looks very natural. Sometimes when we see people that have no expression left, it means they either had too much Botox or incorrect placement of Botox. Our office is nice and conservative and natural. We don't like that overdone fake look. Just like you probably don't either. Mm-hmm. When we do Botox, it's the very tiniest needle that they make. It's really not very painful, just a couple little tiny pokes. So hopefully you won't hear her scream or cry or cuss or any of those terrible things today. So we're gonna start right in here and I'm gonna do 5 little pokes. So go ahead and contract those muscles for me and do a frown. Perfect. And 1, 2, 3, right in the middle. The muscles involved in frowning are your procerus muscle here in the middle and 2 muscles over our brows kind of shaped like this. It's called your corrugator muscle. And by those contracting and pushing together, you will get a frown just like that. Thank you. Frown again for me. Thank you, and relax. And then frown again. 2, 3. And you can see that Erin is very tough. She's a very good patient. And so go ahead and raise up your brows. Thank you, and then relax. So there are FDA approved amounts or doses that work the best for most patients. You can tailor that to your younger client or to someone like Erin that really doesn't have too many deep lines. The FDA approved amount for this glabella spot is 20 units, which is pretty typical. I do that on almost everybody. It's also 20 units for the upper forehead or the frontalis muscle here. And then it's 24 units on the eyes, so 64 total. Like I said, on somebody that doesn't have a lot going on, I may tailor that and do just a little bit less. Kind of depends on your patient. You're doing great. So turn towards me just a little bit and then raise up your brows. Thank you. Okay, and relax. Raise up again. Thank you. Most people, we do 5 or 6 injections here in the forehead. Great. Next, I'm going to do her eyes, or crow's feet, typically is what people call them. All right, so a big smile for me. Thank you, and then relax. 1, 2, 3. Typically, we do 3 pokes. Botox lasts 3 to 4 months and usually kicks in 7 to 10 days. So a good long time before you have to come back and do a little more. Okay, smile real big. Thank you, and relax. 1, 2, 3. And then the last thing we'll do is her chin. And so the chin, I'm going to have you crumple up for me. Thank you. And then relax. And it's going to be 2 pokes. So 1, 2, 3. And 1, 2, 3. So the only bummer with Botox is you don't have that instantaneous result like you do with the filler. Because as you'll see, when Kendra comes next and does her wonderful cheek fillers, she's going to look different as soon as she leaves. With Botox, you have to be patient and hang in there, and it really does kick in within that week. But that's it. You can see she just has a couple little red marks, but otherwise, did great. Not a big deal.
Easy peasy.
Nice job, Erin. All right. Thank you, everyone, for watching today. We really appreciate it. And next will be Kendra for the filler.
Good? Okay. So you got to know Erin during the Botox demonstration. So I'm going to be doing cheek filler for Erin. And if you look at Erin's face, you might think Erin does not need any filler at all. She's got a pretty full face. So we're not trying to, the last thing we want to do is make her look puffy, make her, nobody wants to look like a chipmunk. But what we're going to do to use the filler is kind of create more of like a built-in highlight and contour. She's got gold, so we're going to take that beautiful feature and we're going to highlight it. She's also got nice fullness here that we don't want to get rid of. As we have birthdays, our fat pads that were here and here really start to thin out. They separate and everything slides down. So sad. But we're going to fill those fat pads back in, create more of a contour. You should see a little bit more shadowing under here. It's actually going to even make her face look a little bit thinner, which is counterintuitive. So my plan for Erin is we're going to go on the left side, Finish up on the right side, go back to the left side. There and there. You don't really need to know that, but if you look carefully, you can see the right side is a little bit flatter than the left side. The cheekbone on the left side is also a little bit higher. So part of my goal is not only going to be to create that contour, but also to improve the symmetry of her face a little bit. Voluma has indications, that's the product we're using. Voluma is part of the Juvederm family of fillers. Has indications up to 2 years. And with that, we really want to treat it like it's a surgical implant. So Erin has not had any recent dental work within the past 2 weeks. She has not had any infections. She is not suffering from current chronic sinusitis, anything like that. Anything that would send your immune system into overdrive nicely. So make sure when you're planning your filler appointments that you're 2 weeks out from any dental work, surgeries, sickness. It's incredibly common to bruise with filler. I anticipate a bit with the Botox. I anticipate that we're going to have a bit of bruising with the filler today too. That is completely normal. So again, make sure you're timing your filler appointments with any major events. I don't want to be halfway through your filler and I say, oh, you've got a bruise, and you say, oh, I'm getting married tomorrow. Please don't do that to me. Don't do it to yourself. To remain really, really clean when you are doing filler. Like I said, we treat this like it's a surgical implant, and this type of filler goes in deep. It goes all the way down to the bone. So we want to make sure that we are not bringing any bacteria that lives happily on your skin, has a nice symbiotic relationship when it's outside your body. We don't want to bring that into the skin. So please, when you're getting filler, don't touch your face. So I usually like to clean with alcohol first. It's going to be a little bright, refreshing in your eyes. You get really pink from this. All right. So Erin gets pink from everything. So Erin tends to get pink and bleed. So not everybody does. If you are on blood thinners, if you drank the night before, if you worked out that morning, you have a higher risk of getting some bleeding. Not a deal breaker, but something to be aware of. All right, you ready? All right, so nice and relaxed. I normally don't shake this bad. You guys make me so nervous watching at home. So just go nice and slowly. How was that first couple pokes? Good. Pain with cheek filler is usually none to mild. Really the biggest complaint that we get is because we're going so deep, we're going through so many layers of muscle, you can kind of hear a little crunching sound. It's not super pleasant, but again, it's not a deal breaker. So already, your hair's in it. Talk about cleanliness. All right. Already you can see this really nice timelessly beautiful. Sure, every era, high defined cheekbones is a marker of beauty. Swapping out my needle because a sharp needle is a painless needle. I do it. It's the little things. You know? Oh, now we're gonna start on this side. And this is our side that needed a little bit more love to begin with. You can see I'm pulling back on the syringe before I place any product into her body. I want to make sure that my needle is not in a blood vessel. If it gets in there, that can cause some complications. Luckily, we at Dr. Beals' office have a protocol in place, and we have all safety and reversal measures in place and thought of. We have protocol, we have product. That's something super important to, be aware of if you're getting fillers. Are the people injecting it safety minded and ready for any complications? We never expect them, but it's always good to be prepared.
This really does not hurt at all.
Good. You look so serene. Who could be upset with new high elegant cheekbones? All right, so that was the first syringe. I know a lot of people, when you hear one syringe or, two syringes and you hear, sometimes people picture we're coming in with this massive syringe that's just going to be able to treat the entire face. But that's really not the case. For doing cheeks, I usually, unless you're like 22 years old and just need the tiniest little touch up, I usually start with about 2 syringes for facial treatments and go upwards from there. Each syringe only has 1 milliliter of product in it, which is just a teeny tiny amount. If you're not familiar off the top of your head with what 1 milliliter looks like, picture your measuring spoons in your kitchen. So your smallest one is probably a quarter of a milliliter, or I'm sorry, a quarter of a teaspoon, which is still bigger than 1 milliliter. 1 mil is a fifth of a teaspoon. So we're just dealing with a small amount of product. Like Jamie said, like I said before, we are a pretty conservative office. We don't want alien cheekbones, abnormally sharp jawlines, but you also want to make sure that you're using enough product that you see a difference. So it's just finding that balance. You look so savage. Blood. Yeah, I wasn't going to call her out when I mentioned, thank you. When I said, if you drank last night. Okay. Do 2 little injections up here just to kind of soften the transition and bring that extra height to this left cheekbone, or the right cheekbone. A couple things we need to pay attention to as injectors. One of them is, what are we doing with our non-dominant hand? So I'm right-handed. I'm using my right hand to place my injection. So you hold my needle. And I'm using my left hand to pull the skin back, lifting it up. This is a technique called tacking back, because what I want to do is I want to pull all of the tissues this way, up and out. And then when I place my product, I'm hoping that it's going to act as kind of like a stop. So that little bolus of product down there is going to prevent the tissues from all falling back down. I had to remind myself of my game plan. Look at that. Just that really pretty full cheekbone right there. Gorgeous. So now I'm going to place an injection in kind of a new spot. This is one of my most favorite areas to treat recently. So it's kind of the new modern way of treating the nasolabial fold. Just treating the cheek alone will help the nasolabial fold. That's the line that goes from nose to, mid-cheek, corner of the mouth. And that was the first place people started treating when filler came out. But if I was to fill this area and she were to just flatten out across here, she'd end up looking a little artificial, a little bit like a leopard, as one of my friends said. So what I'm going to do is I'm going to put some product deep right there because we lose so much bone. And if you watched my presentation at the open house, I like to use filler to replace lost fat pads and lost bone. In there, and that's going to soften this and also help further support the cheek. Some people don't feel it at all. Some people, it's a little bit more of a stingy spot. Look at that. And you can see, good. You can see just how much softer that transition is while still keeping it completely natural looking. You don't want to smooth that out completely. I mean, even newborn babies have a little bit of a transition there. Swap out my needle again. We'll do 2 more pokes and then we'll be good. Little poke. Pull back. I love doing filler, mostly because I can be kind of impatient and filler is instant gratification. You know, you'll have a few bruises when you leave the office, so it's fun. For 4 to 6 hours because she has all these little tiny open wounds, and if she puts makeup, you know, filthy, disgusting makeup on it, then we're risking bacteria getting into those wounds. So, you know, it is a aesthetic procedure, and I think sometimes we can not take those as serious. But it is super important to remember that this is a medical treatment. This is a medical procedure. So cleanliness, sterility is important. What you do before and after is important. What product you're using, who you're going to is all very, very important. And last little one by your nose. I know sometimes it can be tempting to go on Groupon or just try and find, you know, the cheapest ones. But it's really, when you're dealing with a medical procedure for your face, what's most important is experience, education, and the integrity of the office. All right.
Am I 20 again?
Yes, you were 20 when you came in. So we could talk about Erin for a minute, like she's not here. 2 of the reasons why Erin looks so youthful, even before her filler. One is she does have a fuller face, and having a fuller face will always make you look more youthful. And 2 is she takes remarkable care of her skin. She's going to have phenomenal results with the filler, with the Botox, because her skin is so healthy. Filler and Botox really do look best when your skin health is optimized. So that's one thing that we specialize in at Dr. Beals' office, is really treating the face as a full. It's not just a little group of muscles. It's not just a group or a wrinkle. It is bones, wrinkles, deep structure, superficial structure, and the envelope that covers it all is the skin. Do we have a mirror? You're so pink from me scrubbing you. It's like you have built-in blush.
Check it out. Oh, it's gorgeous.
You look great,
This is remarkably different,
right?
but not noticeable.
No. No.
I've not done that before.
No.
I've done this before. I've not done this
Yeah. So this is my kind of my new slogan is people will be able to tell that you look better, but not be able to know why. People will usually, after cheek filler especially, people will be like, did you lose weight? Or did you do something different? They're not going to be like, oh, cheek filler. You know, we want people to, we want to turn your heads, but we don't want them. Good. I think you look beautiful. All right. Is that? So this is filler. And the Botox you can't see yet, but Botox is going to look phenomenal because Jamie always does amazing Botox. If you have any questions, please don't hesitate to call the office, 480-947-6788. You can schedule some appointments. You can also call in after this. We do have a special for webinar attendees only. It could be the only reason why you're attending right now is to get the special. So if you get cheek filler, so what we just did for Erin is the 2 syringes, you get 40 units of Botox for free, which normally 40 units of Botox is $480. If you choose to get lip filler, which we did not demonstrate today, you get 20 units of Botox for free, which is a $240 value. So you save a ton of money. It's a good day for Botox and filler. So check out National Botox Cosmetic Day so you can get some good deals on your future purchases of Botox, and call the office, talk to Kathy or Nicole, and they'll get you all set. It is our busy season. We're booking out about 2 to 3 weeks in advance. So make sure that you call quickly so that you can get in before Christmas time. Thank you so much for watching. And we'll send an email to attendees. Thank you, Evan, behind the scenes, who just told me that. All right. Thanks so much for watching, guys.